So, Professor Gould back. We're going to talk now about moving the glenohumeral joint. Remember, that's the humerus in the glenoid cavity of the scapula, and the movement of the humerus itself. Now, we're not going to talk in this section yet about bending the elbow. That's the next unit. We have a separate set of muscles for that. Right now, we're just talking about moving the humerus in that glenohumeral joint. Okay, so we've already met many of these muscles. Sternocleidomastoid here, there's our little subclavius there, there's our pectoralis minor and our serratus anterior. Now we're going to meet some of these other muscles that may originate on the scapula but insert on the humerus. The first one is the Pectoralis Major, this really big chest muscle, kind of a fan shape that sits right here. This is your primary arm flexor. So it brings your humerus forward. Okay, make sure you don't confuse arm flexion with elbow flexion. Okay, I'm sorry, I'm at my desk, so I can't really do this with a straight arm. And with abduction, which brings the arm in the same plane as anatomic position, but up away from the midline. Okay, this is bringing the arm forward. The Pectoralis Major also adducts and medially rotates the arm, especially that adduction if you use the inferior fibers, and medial rotation, and it has to do with its insertion. So the origin is this big, huge thing from the clavicle all along the sternum, and then even on the ribs 2 through 6. Okay, so it's just really, really big origin. The insertion is the intertubercular sulcus. Remember that little groove right there on the front of your humerus? Yeah. Your giant pectoralis major muscle just inserts in that little groove right there, which just creeps me out that there's this, but don't worry, it's got friends that insert in there as well. That groove is not big enough for all the things that attach there, but apparently it works because nature is weird. So if you think about bringing the front of your humerus towards your chest, then you're gonna do, you can do this, yeah, flex the arm this way, but you can also bring the arm down, and if you're bringing the front of the arm toward the lower chest, you can rotate the shoulder this way. I'm gonna, can you see that better? Not really, okay. I'll keep my arms to myself. Now, on the back, the inferior back muscle is called the Latissimus dorsi. We sometimes call this the swimmer's muscle because it's used to pull the arm back to extend the arm. It also adducts the arm and medially rotates the arm. And for those of you who are thinking, no, the Latissimus dorsi is on the back. It's going to extend and laterally rotate the arm, don't you think? No, it medially rotates the arm because its origin all the way along the lower vertebral column, all the way down to the iliac crest. Its insertion is on the intertubercular sulcus with the pectoralis major, right here on the front of your humerus. So this big muscle from the back comes around here and inserts on the front of your humerus. So it pulls the front of your humerus toward your back. So it medially rotates the arm and extends it backwards. Okay, like that. So this is the thing you use when you swim. That's why it's called the swimmer's muscle, because it does that part of the swim. And it's really well developed on swimmers, as is the trapezius, because you still got to do that. Now, the deltoid muscle. All right, deltoid is this big muscle that goes around your shoulder like this, okay? It originates from the acromion and the end of the clavicle here, all the way around to the spine of the scapula here, okay? So the trapezius comes down to here, and then from that same spot, the deltoid goes down from that spot down. And it inserts, you already know this, on the deltoid tuberosity, okay? And because of that movement, because of that origin and the insertion, it's gonna try to bring the lateral humerus toward the top of the scapula. And so it abducts the arm like that, okay? If you use the anterior fibers, it's gonna help to flex the arm and medially rotate. The lateral fibers are gonna extend the arm and laterally rotate, okay? Posterior fibers, laterally rotate, okay? So again, really complex motion. If you participate in a sport that has you frequently turning that arm and abducting it with power, then you're going to have really well developed deltoid muscles, as Serena Williams, girl's amazing, does. Now, one little muscle that you've probably never heard of, the coracobrachialis. It originates on the coracoid process, right here on the scapula, right next to the pectoralis minor, and it inserts on the humerus. When you see brachii, brachialis, think humerus. Okay, brachii means arm, and it specifically refers to the upper arm between the humerus bone. So the coracoid brachialis is going to be a synergist to the deltoid and the, what are we doing? Flexing the arm and the latissimus dorsi. So it's this little tiny muscle. It's like really skinny. Look at it, it's so thin. It's going to help to adduct the arm, bring the arm down, but also to flex the arm. Sorry, not the latissimus, the pectoralis. Okay, it's going to bring the arm forward. Now, when we look at the back of the body, we're going to have muscles that pull the arm back and especially laterally rotate. The Teres Major is a synergist to the latissimus dorsi. Hang on, weren't you saying laterally rotate? Yeah, I know, but I snuck in another medial rotator because the Teres Major has the same insertion as the latissimus dorsi, which is on the front of the humerus. So the Teres Major is this little band of tissue here. Teres means long and round. So this is sort of a cigar-shaped muscle. On some of our models, it looks flat, but it's kind of round in real life. And it goes from this inferior angle of the scapula to the anterior humerus to the intertubercular sulcus and the lesser tubercle, okay? So just like the latissimus dorsi, it's gonna pull the arm down, medially rotate, and extend, okay? So it's a synergist for those movements. All right, now, the dreaded rotator cuff. Turns out the rotator cuff is 4 different muscles. These are all actually synergists to these big muscles that we've already talked about, but they're really important synergists. And because they're all kind of small, they can get damaged really easily. Sometimes when you damage your rotator cuff, you have actually damaged the muscles. Sometimes you've damaged tendons or ligaments somewhere that are involved in rotating your shoulder. You may have done more than one. You know, don't limit yourself. Please don't hurt your rotator cuff. It's terrible. Okay, so remember all those fossae on the scapula that I made you learn? And I said, when we get to the muscles, you're going to be grateful. Guess what? The muscles have the same name as the fossa. So the supraspinatus muscle sits in the supraspinous fossa, inserts on the humerus. The infraspinatus muscle sits in the infraspinous fossa and inserts on the back of the humerus. The subscapularis sits in the subscapular fossa and inserts on the front of the humerus. Easy. The only other one is the teres minor. Superior to the teres major, because it's a minor, it's going to sit on the major's shoulders. And it's going to go from the inferior medial edge of the scapula to the back and bottom of the greater tubercle. Okay? So what motions are these going to make? Well, think about it. This one sits on the front of the scapula, so it's going to bring the scapula forward. And this diagram is nice because you can see the subscapularis, but it sort of is weird because it doesn't show where the rib cage is, because the rib cage is in front of the subscapularis, okay? So the subscapularis sits back here on the front side of the scapula and inserts here on the front side of the humerus, okay? So it still has to do that sort of through the armpit passage to get there, okay? Supraspinatus, right here, right above that spinous process. Yeah, that's where your supraspinatus is. Inserts on the top of the humerus. So what's it going to do? It's going to abduct. Okay. Now, infraspinatus and teres major are back here. So what are they going to do? They're going to pull the arm back and they're going to laterally rotate the arm. Okay. So, okay. So if you're like playing tennis or throwing a baseball, yeah, you're going to use all of these every time. You're going to extend and laterally rotate the arm. Then you're going to abduct the arm as you bring it over and medially rotate the arm as you bring it forward. You're going to use your whole rotator cuff. All right, so supraspinatus is the abductor. Subscapularis is a medial rotator. Infraspinatus and teres major both abduct, bringing down, and laterally rotate. Okay? So they're pulling the humerus down toward the inferior scapula. So here's a diagram from your book, and I don't know if they've updated it in the latest edition. I meant to ask them. Oops. But this picture, it says movement of rotator cuff muscles, and it has this labeled as subscapularis. But this picture has his arm laterally rotated and extended. So he's actually using the infraspinatus and teres major. Supraspinatus is abduction of the arm, but also helping with flexion. And then medial rotation is using the subscapularis. Okay, so that's why I left these crossed off, because that's the way they are in your textbook, but these are the correct ones. Okay? All right, now on our models. All right, so Mini Muscle Man has this light pink thing right here. That's the infraspinatus, okay, peeking out from behind the trapezius. That's that there. Then you can see these two little bands here and here. This is the teres minor, and this is the teres major. Okay? This is the back of the arm, just the arm model, and this is the back and the top. We've taken off the deltoid that attaches here. And so we have the supraspinatus here, the infraspinatus here. It looks like it's many parts. It's all one muscle. Okay? And then this, supraspinatus is all of this. This is the teres minor. Okay? Remember, teres minor inserts on the back. Teres major is this bottom strand, and it's going to come around. Here it is, and it's going to come around and insert on the front below where the subscapularis inserts. Got it? Okay. All right, other muscles that we need. This is the coracobrachialis right there. Okay. That's the end of the subclavius. Okay, so the coracobrachialis kind of starts right behind it and goes down like the medial side of the arm. And then here's your pectoralis major and your deltoid muscle. Okay, so that we do have the deltoid muscles on both of those. All right, so hopefully that helped you orient yourself. In the next part, we're going to talk about the muscles involved in bending the elbow.